What is the best treatment for marionette lines? First of all, let's define a marionette line. That's a euphemistic term because marionettes, like puppets, have these folds that emanate from the corner of the mouth and protrude down here. And behind that, just posterior to that, is often a fold of tissue or a fullness of tissue we call the pre-jowl sulcus. This is the sulcus, and this is the heaviness of tissue. So the first thing that I look at when I see an individual is what's the reason for the marionette line? Is it, one, loss of volume, deflation? Two, is it sagging of the tissue behind the groove or the line? So obviously, if there's generalized sagging of tissue, I prescribe some form of lifting of tissue. It could be surgical, it could be thread lifts, but I like lifting of the tissue because that makes the jawline look better and all of the tissue look better. However, if the patient has a relatively isolated line, or if the patient does not want surgery, and we've discussed that, then I like filler for this. And filler works very well. What we have to do is volumize along the jawline to fill out the area where we've got the fold. And that fold, again, emanates from the corner of the mouth and goes down into a sulcus where the ligaments attach to the bone the most tightly. And we're really lifting that ligamentous area up. So I love filler along that line. If I do filler to get rid of or to reduce the marionette line, I do it deeply on bone down here. And then I often will put a little bit of superficial, close to the skin, filler here to push up the corner of the mouth. What we don't like is when the corner of the mouth goes down. Many of my patients call that their resting bitch face. Well, whatever you want to call it, a depressed or a down slanting corner of the mouth makes us look tired, makes us look a little angry, and my patients don't like it, and it makes you look a little older. So I try to push that up with a little bit of superficial filler here. So deep filler on the bone and superficial filler here. How long does filler for marionette lines last? It depends on how long that filler lasts. And I find that commonly, if I adequately augment the jawline and push up the corner of the mouth with enough filler, I've filled the balloon enough, I get 6 months at a minimum and often 8 or 9 months with the filler injection. If you have questions about this, how do you treat the marionette line? Any sagging of tissue with it? Is filler going to be enough or not? Come see me, call me, email me. I love seeing patients and talking to patients that are like you, and I would be glad to see you in my office or to chat with you via email. Thanks so much.